Good morning. Welcome to the City of Toronto's COVID-19 media briefing for Monday, December the 23rd, 2020. Joining us today is Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, good morning and thank you, Brad. We remain under lockdown now, and a further, harder province-wide lockdown starts on Boxing Day, the day after Christmas Day. I continue to urge all Toronto residents to stay home as much as possible. Please stay home. And I urge people again to understand that this Christmas has to be different. Please limit your in-person Christmas celebrations to only the people that you live with. We've been getting ready for a very different kind of Christmas by FaceTiming our children and grandchildren, and it's not the same, but the connection is still very real. We all need that connection. We all need that love and support, especially right now. I know this won't be an easy Christmas for many, and I understand that after this long, difficult year, we all want to be in person with our loved ones. But your sacrifice this Christmas by not being with any of your loved ones that you don't live with will help protect your family and friends and help to stop the spread of this virus in our city. This week, more vaccine was rolled out to more hospitals in our city and more long-term care workers, some of our bravest frontline heroes. Throughout this pandemic, they actually received a vaccination. We're going to get through this tough time, but we need to hunker down right now to protect each other, to protect the healthcare system, and to help those very same frontline workers to protect them, because our behavior in stopping the spread of this virus also protects them so they can do their work to protect us. Now, our city's commitment to helping residents in areas that have been disproportionately hard hit by COVID-19, those efforts are continuing. Today, I'm pleased to announce further investments that will help vulnerable residents of our city and the neighborhoods in which they live. Funding from the third round of our TO Supports Investment Fund is flowing now, and it'll flow through to the end of the year to community-based agencies who are supporting vulnerable populations impacted by this pandemic. The City of Toronto is allocating an additional $3.12 million from the TO Supports Investment Fund for community-based investment agencies that are supporting vulnerable populations impacted by the pandemic. This is on top of the $4.6 million in funding that we announced in June and the $1.9 million announced in October. Including this round of funding, we will have invested almost $10 million in some 85 different community-based agencies who are themselves supporting vulnerable populations in our city impacted disproportionately by this pandemic. Funding for this round includes $1.96 million from the city's allocation of the Social Services Relief Fund from the province of Ontario, and I thank them for their initiative in that regard, and $550,000 from the Scheinberg Relief Fund, which also provided an additional $370,000 in the first round of funding in June. Priority was given in allocating this money to community-based agencies providing support and services to Torontonians who are the most vulnerable in this pandemic, as well as to communities experiencing disproportionate negative impacts by COVID-19. So this includes low-income households, seniors, residents who are experiencing homelessness, individuals with mobility issues, quarantined or in self-isolation, households in the inner suburbs and the Tower neighborhoods, Indigenous and Black residents of Toronto, newcomer and refugee populations, and neighborhoods with a greater number of COVID-19 cases, as we've seen, for example, in the northwest and in the northeast of the city. Our partners continue to hear about these agencies that are out working with people, unmet needs with respect to food security, mental health supports, and connectivity. So this round of funding primarily focuses on support in those areas where we've identified outstanding needs. 26 of the 33 recipients of this money recommended in round one are again recommended in this round to extend the impact of their work, which has been judged to be positive. I won't take you through the whole list, but I want to just highlight a couple of the areas in which we've made investments as a city to help with groups that have been disproportionately hard hit by COVID-19. $420,000 of this money in recommended allocations is to Indigenous agencies, including $300,000 to the Toronto Aboriginal Support Services Council, called TASC, and they in turn will put the money to work with mental health and food security and other agencies, some 20 other agencies that help our urban Indigenous populations to deal with the impact of COVID-19 on them. Approximately $1 million in recommended allocations is made to organizations that are serving principally the Black community in COVID-19 responses. Unfortunately, these are populations that are themselves experiencing a higher than average impact of COVID-19, and so it is necessary and appropriate and right that we should focus on these communities with this kind of assistance, because it will make the biggest difference for the greatest number. I thank Premier Ford, Minister Steve Clark, and the Government of Ontario, our funding partners, for helping to make these grants possible, and of course the Scheinberg Relief Fund as well. This program has been fundamental to our ability as a city, working with our community agency partners, to make sure that we can help those who need help the most. Investing in community-based agencies has been central to the work that the city is doing. These agencies are on the ground, they're trusted, they're known, and they're used to providing help to those who need it the most. It has been clear that they know what the issues are and how best to address them, as opposed to somebody sitting in a government office or anybody else. No disrespect to our hardworking public servants. I want to thank these agencies and their frontline workers for being strong partners for us and for continuing to help our residents in this city, especially our most vulnerable residents, get through this pandemic. The city is doing everything it can to keep all residents safe, and we will continue to do so. And so I welcome the fact that the Province of Ontario has signaled that it too will be providing additional funding towards community-focused efforts to help our hardest-hit neighborhoods and stop the spread of COVID-19. Earlier this morning, I contacted Police Chief Jim Raymer following a question raised on television of me, and I asked him if he would consider relaxing parking enforcement over the holiday period and in light of the extended lockdown that is to begin on Boxing Day. He immediately agreed to do so, and will provide through the police service the needed direction with details, and then the details in turn will come from Superintendent Scott Baptiste later today. This, I think, will be something that will provide a degree of flexibility for residents during this quieter time, both because of the holidays and because of the lockdown. Fighting COVID-19 has to be a team effort, and that has been central to the city's approach throughout this crisis, whether it's working with nonprofit agencies, working with the community, or governments working together. We've tried to work with everybody we can, with our residents, with other governments, with agencies, businesses, charities, companies, associations, the BIAs who represent the small business communities across the city, and every other entity that we could possibly find to help us respond to this pandemic. I have been amazed by the commitment of so many people over the course of this year to helping out in some way, and I have been amazed by the people that we've called on to coordinate this effort, and by the volunteers they in turn have brought to the cause of fighting COVID-19 and supporting their fellow residents. It's one of the most encouraging aspects of this over the course of the entire time that we've been at this. Our frontline heroes have faced this danger with such commitment and courage, day after day, coming to work on days when almost no one else was going to work. Many of them won't get a break this Christmas. They'll be working on Christmas Day and on Boxing Day and all the other days, because a lot of the services they provide don't stop being provided, and the need for them doesn't stop existing on those holidays. And they'll be continuing, of course, in our efforts to combat this virus in many other different places. On the broader public service side, nurses, hospital workers, doctors, long-term care, transit, road and snow crews, fire and EMS will join many in the private sector, including, for example, people in our grocery stores, in working over the holidays, and we thank them for their extraordinary effort. We thank them in advance, and we thank them for the past efforts they've rendered over the last number of months. They are helping to see us through to a safe vaccine for people and ultimately a return to a more normal life. To help wish our frontline workers a Merry Christmas and show our ongoing and everlasting support for them, the city is encouraging all residents to stand outside their front door or on their balcony or on wherever they can tomorrow night, Christmas Eve, at 6 o'clock in the evening, and to ring bells or bang pots and pans in a pinch. This is a tribute that is part of a worldwide Christmas Eve jingle in honor of frontline workers of all kinds. So please think about doing that, and make sure Toronto sends that message loud and clear, just to our own community but also around the world, in thanks to frontline workers. I hope everyone ringing bells for these workers also pays tribute to them by following public health advice, because that's meant in part to protect them as well as to protect each other over the holidays. And the principal element of that public health advice is, of course, to stay home as much as possible. Staying home, keeping our distance, not gathering over Christmas with people we don't live with, washing our hands, and getting tested if we have symptoms is the least we can do to protect these workers, keep our healthcare system from being overwhelmed, and to ensure that as many of us stay healthy as possible. To those who have not been following public health advice, please think for a moment about the so far, and I hate to say that, but so far the 1,801 Torontonians we have lost this year. They've lost their lives due to COVID-19. Think about their Christmas or the Christmas of their families without their loved ones. Think of the 85 Torontonians who are just admitted to hospital, 52 of them with breathing tubes, and they'll probably have those breathing tubes in on Christmas Day. Think about the people who will get sick just so that you might attend some sort of a party or gathering or go somewhere that you've been asked not to go. To those who have followed the advice and the rules, I am sure I speak for everybody here at City Hall, the entire council, all the people who work here, and for all the people of the City of Toronto in saying to you, thank you for your sacrifice. We're grateful for the fact that you have complied with the rules and sacrificed as you have and will sacrifice over the holiday period. You will be rewarded with a stronger and renewed and recovered City of Toronto sooner than if you didn't sacrifice now. I'm hugely optimistic about the future of this city, and I think that's with plenty of good reason. So let's act over the holidays in a way that will make that hope a reality for us as early as possible in 2021. And I wish everybody the very best, because it's the last time we'll speak to you in this particular setting, the very best for a holiday that is in compliance with public health, but nonetheless a happy holiday, a happy New Year, and a Merry Christmas. I've been saying quite often that 2021 is bound to be better than 2020, which I realize isn't a very high bar, but I think we can look forward with hope to a better year if we follow along on the things that are fairly straightforward that we've all been asked to do. And on that note, I would ask Dr. de Villa to offer her remarks for today.
Thank you, Mayor Tory, and good morning. As the Mayor just stated, measures have been in place since the province moved us into our current status, and these will be enhanced across the province on Boxing Day. Many people are asking, is this going to work? And has it worked so far? And that's a fair question, given the nature of the case counts. So to that, I'd say this, which I have said before. It's hard to prove what didn't happen as a result of the measures that have been implemented. I'm confident the measures have limited the resurgence of COVID-19, because if you look at other places that opted for more limited responses, you see the result reflected in the spread of the disease. I think there's merit to the province-wide approach, because if we can reduce the amount of contact people are having with one another, it follows that COVID-19 will find it harder to spread. The virus needs us to give it the means to keep spreading. COVID-19 has infiltrated every aspect of life. No one component of a plan is going to solve this problem. Bringing COVID-19 under control will be the result of multiple solutions, and this includes the choices that each of us makes where we can in our daily lives. On this, my last report before the holidays, I'm reporting 628 new cases of COVID-19 in Toronto. There are 321 people in hospital, and 85 people are in the ICU. Sadly, we have received reports of another 17 deaths. The end of life is one of life's few guarantees, but in so many instances over the course of this past year, I found myself wondering how many of those lives lost might not have been lost this year if COVID-19 hadn't come along and spread as it did. On Monday, we spoke of a 30-year-old in Toronto who died because of COVID-19, and of an 11-year-old fighting COVID-19 in hospital. I feel for these two families and the many others who've also suffered. Their suffering is a reminder to all of us that COVID-19 is, above all, unpredictable, and that when it behaves unexpectedly, it can do so with terrible consequences. While medicine knows what is likely with a COVID-19 infection, there are no guarantees. I'm thinking as well of the heroic people working in Toronto's hospitals as the case counts rise. To go into work in hospital or in another healthcare setting these days involves no small amount of courage. For all its rewards, healthcare can also be very draining for its practitioners. The reality they face this year is even more so. But I know they aren't giving up on any of us, and we can't give up on them. We must be on their side and show it by keeping apart, to do what we can so as not to make this bad situation worse. By this point, we know well what that means. Staying home when you can, keeping as much distance when you can't, masking up when you're out, and in the next few days, making the toughest choice of all. The actions that offer the most protection this Christmas will be the hardest to take. Traditions at this time of year may as well be part of our DNA. So to say that we'll stay apart this year is easier said than done. It is understandable under these circumstances to want to do what you always do. It is natural to want to rebel in some way against all the obstacles we face. But this is just 1 year of the unusual. And next year, I believe that we can expect better things, and hopefully with a new appreciation and a better understanding of all things. So with that, and on behalf of Chief Pegg and behalf of the team at Toronto Public Health, I wish you all a happy holidays. I ask that you please stay home, stay safe, and take care of each other. I'll now turn it over to Brad.
Thank you, Dr. de Villa. I understand we were having some audio issues off the top. I think they're resolved now, so I do apologize for that. That's 2020 in a nutshell for you. Just so you know, this press conference is streamed and is available on YouTube, should you wish to go back. Our first question, and Chief Pegg is on the line as well, if anybody have questions for the Chief. First question is to Austin Delaney from CTV News. Austin, go ahead. And you will need to unmute.
Hello, Doctor. My question is for you, Doctor. The Moderna vaccine has been approved by Canada and also for the mayor. Can I have some reaction to that, please?
So with respect to the approval of the vaccine, I think this is wonderful news. As we've been indicating, this adds one more tool to our toolkit as we seek to fight COVID-19 and its spread in our community. So this certainly is a welcome news and perhaps an early holiday gift.
You can't help but be very happy with more vaccines hopefully to come in approval, and I think what we're doing is focusing on our job, which is for the next stage of the vaccine. The province has sole responsibility for the first stage, but the next stage we will be involved in, and we're hard at work under the leadership of Chief Pegg, making sure that we're prepared for that, so that as these vaccines become more available in greater supply, and as we reach the second stage when more people are going to be getting vaccinated, that we're ready to play our part, which as a city we will be.
And as a follow-up, tender care in Scarborough, a long-term facility there is in dire straits. There are 118 resident cases, 21 residents died. A doctor who responded there on the weekend said it needs to be called in. Dr. de Villa, any reaction? Do you think the military should be called in?
So I'm sorry, I didn't hear the details of the question, but as I understood it, it was in respect of a long-term care home where there are some significant challenges in terms of managing COVID-19. So I don't have the specific details with me today, but I can certainly tell you that the team at Toronto Public Health is working in partnership with all long-term care homes in the city that are facing outbreaks, and as well the management of outbreaks and the support in order to manage those outbreaks is done in partnership with hospitals as well and other healthcare providers. There's no question it has been extremely challenging, and there are certain long-term care homes who have certain infrastructure or they're set up. Older homes are more challenging in which to control COVID-19 spread. So all the options are always on the table in respect of what are the best approaches. We have to decide what makes sense in the context of long-term care homes based on what's happening on the ground. And those decisions are taken as quickly and in an evidence-informed way as is humanly possible.
Okay, thank you. I don't know if you can hear still. I know we are having some significant technical issues. I'm going to try Dave Ryder from the Toronto Star. Dave, can you hear?
I can hear from a distance.
Okay.
Hopefully you can hear me.
We can hear you. Go ahead, Dave.
Okay, thank you. My first question is if you have got the detailed regulations from the Ontario government, and if you know if we are going to require extra restrictions in Toronto, can Torontonians face a tighter lockdown anytime soon?
So, David, we have folks at Toronto Public Health who are looking at those regulations and assessing for opportunities for enhancements or areas where we might bolster, if you will, that which is provided for in those regulations. But in the short term, we know that, we're approaching the time of year where things are relatively quiet, and the most immediate risk is really related to the choices that people make around how they will celebrate the holidays. So we're really hoping that the messaging that we've put out there around staying home and really focusing the activities only with those with whom you live. That's the most important step that can be taken by all of us in the next few days. We're continuing to assess what options might be available to us as life returns to a more regular pace after the holidays. And in particular, we're exploring those options that will allow us to better serve and address the needs of the hardest hit individuals, communities, and neighborhoods in the city as far as COVID-19 is concerned.
Thank you. Sorry, if anybody else is speaking, I can't hear you just because of problems. So I'm going to ask my next question, which is last week, Mayor Tory was calling for a tight lockdown in Toronto soon. I think he thought the announcement would be on Friday. And now we're not having any more restrictions for any part of the province until Boxing Day. There's a story in the Toronto Star today with a pandemic modeling expert saying the delay in new restrictions could cause 10,000 more infections and put a greater strain on the hospital system. Are you concerned at all that there will be a greater impact on Toronto's system because people across the province will have more COVID?
I'll just say, for my part, since I was commenting on that and on the timing that we thought best for Toronto, that Toronto was at that time in a lockdown, continues to be in a lockdown, and as a result, it does turn to what Dr. de Villa said, which is two things. First, people following the advice that's been outstanding for some time and certainly was outstanding during the initial period of lockdown that we've experienced now, which goes for several weeks, which is please stay home. At its heart, please stay home and please avoid contact with other people to the maximum extent possible. And the second thing that we've been devoting a lot of our efforts to during that time, which I think will help, is inside the boundaries of the City of Toronto, which has been under lockdown. We are working very hard to address the needs, as we speak, of the most vulnerable communities where the spread has been greatest. and that's what we've been focusing our attention on so as to bring those numbers down. And so those are the things that we're focused on. The rest of the province will come into line in a lockdown that will take effect in a couple of days from now, and hopefully that will help everybody's numbers, including ours, and make them better in a noticeable way by the early part of the new year.
Add just a little bit to that. You know, as I mentioned in my remarks today, there isn't any one single solution. There is no one single panacea that will help us resolve the issues presented by COVID-19. And when we look at measures in general, they're all geared towards supporting people in their ability to limit their interactions. But at the end of the day, it is about people limiting their interactions. And for a great many of us, right, a goodly proportion of us, we are able to make those choices, to limit our social interactions and to only interact with those with whom we live. So to the extent that people are able to, we really are asking, the more you're able to stay home, the more we will be able to better control COVID-19 and to give those vaccines that are now starting to arrive and starting to be deployed here in our city and all over the world, the more benefit they will be able to confer for all of us. But it does come down to the more we're able to stay home, the better off we will all be.
You know, just following on that message, I'm of an age, and some people out there watching will be of an age that remember the ads that used to be on that talked to people about moderating their drinking. And the ads used to say, you are your own liquor control board. And, you know, people should think about the fact that they are their own COVID-19 containment action plan. And that maybe is through inaction, staying home, only socializing with the people that you live with. And by so doing, I think almost more effectively than all the government rules we could all bring forward, that can be an action plan that could help us bring these numbers down. People have a lot in their own hands between now and New Year's Day and beyond to affect these numbers in a positive way and affect the strain on the healthcare system and all the things that have been talked about.
Thank you. We'll go next to Nicholas Haddad from Radio Canada. Nicholas?
To live with, and by so doing, I think almost more effectively than all the government rules we could all bring forward, that can be an action plan that can help us bring these numbers down.
We've got a delay and we're out of sync. Just stand by, folks. I do apologize for these technical issues we're having this morning with WebEx. Just give us a second and we'll get all of your questions in, I promise.
Radio Canada. Nicholas?
By so doing.
So my question is I think for Chief Pegg, but I'd love to hear Mayor Tory on this as well. You know, as journalists, we can really see close to Christmas, a couple days before Christmas, things grinding to a halt. It's a lot harder to reach people. I think more people are spending time with their families. I'm curious what that's going to mean in terms of municipal employees. You know, we still have a lot of people out in the city who need help, people living in outdoors and parks and so forth. Are we going to see fewer city employees out in Toronto streets during the holiday, these next few days, or do you think you're going to ramp up the presence of these workers?
Hi, Chief Pegg, can you hear me?
1 second, Chief. Just hang on 1 second.
Are we going to see fewer city employees?
Have a bit of a delay, which is interfering with the live audio feed, so it's we're just trying to sort that out. So please stand by.
Hi, Brad, it's Chief Pegg. Can you hear me?
Yes, Matt. Just one moment, please.
Shut this down. Yep. Start.
Okay, folks, here's what we're going to do. We're going to log off, and we're going to ask you to please call back in so we can reset this, and then we'll restart this presser. And the next question will be to Nicholas. So we're going to log this off. We're going to end this meeting, so please log back in, and we'll get started again in about 2 to 3 minutes once everybody's back on. I do apologize. Thank you. Okay, I think we're back. I'm just going to do a quick sound check. I'm going to ask Nicholas Haddad from Radio Canada. Can you hear us, Nicholas?
Hi there. Yes,
And
we're
we can
back.
hear you. This is good news. Thank you.
All right. Sounds clear. Perfect.
Okay.
Do you repeat the question, or do you feel ready to answer it, Chief Pegg or Mayor Tory?
Yeah, so if you could
it's
just
Chief
repeat your
Pegg.
question
I'm
and
happy,
I'll,
Brett.
sorry, Matt, just Chief, 1 sec. Nicholas, could you just repeat your question, please, and then I'll have the Chief answer.
Yeah, so as I was saying, as journalists, we kind of see things grinding to a halt before Christmas. I'm curious if you're planning on having more municipal employees out this Christmas in the next couple of days, or if people are going to be a little bit more absent, and what that's going to mean in terms of people in the city who still need help. I'm specifically thinking about a lot of people who are living outdoors at the moment. And I know that you already have a lot of employees out working with those people. Are they going to remain there for the next couple of days?
You can hear me, Brad?
Please.
Hi, Nicholas. Chief Pegg here. Yeah, thanks very much for the question. We can certainly expect that all of our critical and essential services will continue as per normal and will continue on an uninterrupted basis. We have many folks who, as you know, work 365 days a year, and the fact that the holidays are upon us really don't change any of our service levels. So uninterrupted service, critical and essential. I can tell you as well, our COVID-19 immunization task force and COVID-19 response teams will continue. We have scaled down a couple of meetings in collaboration or in conjunction with the province, specifically on Christmas Day. But that work will certainly continue, and obviously with today's announcement of the Moderna vaccine being approved, I'm sure that work will continue with an increased vigor. Our Emergency Operations Center will continue to operate as it always does, on an uninterrupted basis, and with the availability and on short notice to escalate and scale that should other circumstances arise. So our residents can expect to continue to receive essential and critical services as they always do, and we are fully scalable and available to respond, certainly from an emergency perspective as required.
Thanks so much for that, Chief Pegg. I do have another question. This one's for Mayor Tory. It's a little bit less pressing, but a colleague of mine is working on a story about staffing during the pandemic. And what we've seen is that a lot of people in governments, whether that's municipal or provincial or even at the federal level, are switching jobs within government, finding something new to do. I'm just curious, Mayor Tory, I'm going to throw the question your way. Is that something that you've noticed in your city government?
Well, we've actually, of necessity, had to encourage it to happen to some extent because there were functions of government that were not as necessary or that weren't able to be performed, but we did need people in increased numbers in areas of public health, helping with the shelters, helping with long-term care, and so on. And so while we did have thousands of people who were affected negatively over the course of the summer and fall months and in fact were off work for a period of time, we had many others who voluntarily agreed to redeploy themselves. And in some cases, I presume maybe they either liked the work or found it preferable to what they were doing before. So there's been some movement, some of which we've encouraged, some has happened of necessity, but nothing that has in any way disrupted our ability to provide services. In fact, it's helped us to look after the most vulnerable people in a concentrated way during the pandemic.
Thank you. We'll go next to Ashley Legasic from News Talk 1010. Ashley? You have to unmute yourself, Ashley. There you go.
Sorry, is that better?
Yes, thank you. Go ahead.
Okay, thank you. Merry Christmas, happy holidays, everyone. Thank you for taking my question. Dr. de Villa, this first one is for you, but Mayor Tory, I would like your reaction to this. Lakeridge Health has told us that they've been seeing a spike in people getting tested since the beginning of the month. We're also hearing people had planned on getting tested before seeing friends and family for Christmas, even though that's against the guidelines. Is this something that we have seen in Toronto as well?
So Ashley, I'll have to go and take a look at the numbers directly to be able to answer specifically. But I would say this. I certainly encourage people to get testing should they find themselves experiencing symptoms of COVID-19. And as you know, we're seeking to make testing available, more readily available to those areas of the city that have traditionally had challenges in accessing testing for those circumstances that warrant it. And I think that I would further just state again that for those people who may be seeking testing as a means of assuring themselves that it's okay to socialize outside of their households, I would just ask to really think twice about doing that, recognizing that what's best for their own health and the health of all those around them, including the broader community, is really to stay home as much as possible. It is one Christmas. It is one holiday season. I do think that there is a brighter, there are brighter days ahead, and hopefully a brighter holiday season, many brighter holiday seasons in the years to come. We're asking for people to do differently this year, because it is a different year, and it is the best thing that we can do all together to protect ourselves and our communities at this time.
I have heard just in the last couple of weeks more variations on a theme that sort of suggests there's some kind of an asterisk beside the advice that's offered on the advice of our medical officer of health to stay home and only socialize with people you live with. So we've heard the asterisk that says, well, that's okay to do otherwise if you have a test, or it's okay because it's only your grandmother, or it's okay because it's just a couple of people we're having over. There are no asterisks beside this. The advice is stay home, please, and please only therefore socialize with the people you live with. There are no other things that make it better or make it okay. And we've tried to get that across, and that is based on the best medical advice we can get. And there are the other things that go with that, like wearing a mask, washing your hands, avoiding other crowd scenes, and so on. But there are no asterisks or qualifications that say it's okay to get a test or okay just to have a couple of people over. The idea is stick with the people you live with, period.
Thank you. And for my follow-up, this is actually a follow-up to David's question that he had asked. We know that the second lockdown in Toronto hasn't had nearly as much of an impact as the first one. A lot of things are open that weren't during the first lockdown, and traffic is still pretty busy from what I can see. So if this provincial-wide lockdown doesn't have an impact on cases in Toronto, Mayor Tory, is your team prepared to implement tighter restrictions despite whether or not the province steps in?
I prefer to look at the glass as being more than half full as opposed to being more than half empty, in the sense that I think we're going to see, through a combination of the time of year and the fact that a lot of people at this time of year take vacation or have their holidays that are statutory holidays, and that will reduce the level of activity. And I think we're going to see it in some of the data we get from anonymized cell phone data, for example. And I think people also complying with the lockdown. And the fact is there are fewer things open than ever, starting on Boxing Day. And then after the New Year's, you'll have the schools that will be on a pause for virtual learning for a couple of weeks. So I think all this is going to contribute, assuming personal behavior goes with it, to better circumstances for all of us. But I can only assure you that we meet on a very regular basis. We talk every single day between ourselves in the city government, as it were, and our medical officer of health, and we talk to the province all the time. And you know, certainly for my own part, I wouldn't hesitate to support measures that that the expert advice deems necessary if it's going to help us. But in the meantime, what we're really focused on, we spent all of our time this morning, or virtually all of our time, and we will continue to spend time through the holidays, is on providing supports to the communities where the spread has been greater, because that's a way in which we can stop the spread of this virus, by supporting those populations and making testing more available to them, and helping them with isolation in the event they test positive, and helping them with the different kinds of supports they need for their families. And that's what we're very focused on.
Okay, we're going to go next to Linda Ward from CBC. Linda, did you still have a question?
Yes, I did. I just wanted to follow up a little bit on the Moderna vaccine. I know we are expecting 168,000 doses to arrive in Canada. I'm wondering, given the fact that we know a lot of these are going to be going to far-reaching communities, how many are we looking at getting for specifically the City of Toronto, and when?
So, Linda, as it turns out, I don't actually have the numbers with me, so I'm sorry I can't give you a very specific answer to your question. But certainly the arrival of a new vaccine, particularly one that is, easier to store and can be moved around more rapidly and more extensively throughout the province, is very welcome news for us in our response to COVID-19 and trying to reduce its impact on our community. I don't know, Chief Pegg, if you have any further information.
Hi, thanks, Dr. de Villa. The only thing I'll add is just a reminder that from a City of Toronto perspective, we ultimately receive vaccine from the province of Ontario. I can tell you that concurrent with this call right now, the Provincial Immunization Task Force, what they call workflow or work teams meeting is underway. So with the news of the Moderna vaccine approval, General Hillier and the entire team at the province of Ontario is convened now, and details such as that with respect to arrival estimates and distribution of Moderna and the continuing distribution of Pfizer are on the table. And I expect that we'll receive those details in short order once they've been determined by the province. But at this point, we are awaiting the province.
Thank you. And just a bit of a follow-up, but sort of looking forward to the new year. I know that there's a lot of people who are hoping for a bit of a reprieve in 2021. If you had to make a prediction for the City of Toronto, given we now have these 2 vaccines, how long until we get out from under this thing?
You know that, Linda, that may be the, I don't know, I was going to say $1 million question. It probably might be worth more than that. I think that's the question that we all have in mind. But as we have seen throughout the pandemic, this has been an active learning process. Brand new virus. We've only, not even a year since the virus was identified. We have a vaccine within less than a year. Actually, we have 2 now available, which is a remarkable achievement of science. And it shows how very rapidly science and the scientific community has come together to bring its learnings to bear and to actually implement those learnings in real life. So I think at this point, it's very, very difficult to say. I try not to make predictions about things on which we're still actively learning, so as not to set up false expectations or false hopes. But certainly, having vaccines available out there does give us some sense of hope for the future. I do hope that we will be looking at a happier holiday season for sure next year. I think I can at least say that, and I would keep our fingers crossed and our eyes very carefully trained on what is happening, what the experiences are with vaccine, not just here, but all over the world, so that we can get more refined predictions and more refined assessments around what 2021 overall holds for all of us.
I am no doctor, but one thing I have learned from listening to our doctor is that that if we stay home, only socialize with the people we live with, wear a mask, avoid crowd scenes, wash our hands, that day of reprieve that is being asked about will come sooner. So that is added to the vaccines. But if we do those things, the day will come sooner without being able to pick a day, because I don't think anybody can. But we sure know that I think if people follow those basic rules, especially over the holidays and beyond, the day of reprieve will come sooner.
Okay, thank you. We'll go next to Travis Danraj from Global News. Travis, go ahead.
Hi there, Mayor Tory, Doctor. Thank you for taking my question. We're doing a follow-up on an article that actually was in the Star yesterday about a Toronto sex shop owner who was ticketed and summoned to court for breaking lockdown regulations. She was fined $880. However, she says that, she spoke to the city, she spoke to Toronto Public Health, and they told her that her store falls within a category which would be open, essential, because she has products in the store for safe sex, for issues with gender dysphoria and other medical conditions. Can you explain why this fine was given and what the rules are around places like this that are kind of in, I guess, a gray area?
Travis, I'm going to ask Elizabeth Glibbery from our Municipal Licensing and Standards, who's here for Carlton Grant, to try and address your question. Elizabeth?
Good morning, and thank you for the question. I'm not going to comment on a specific investigation as it's active, but I will say generally that the city expects all businesses to comply with the lockdown regulation, and the regulations have been put in place by the province to determine which businesses can remain open and which remain closed. Based on our information, the lockdown regulation focuses on and describes businesses by the type of business, and sex supply shops are not on the list of businesses that can remain open to the public.
Follow up, Travis?
I'm just wondering, there's a clinic and a pharmacy on Church Street, which focuses on LGBT health, and they carry a lot of the same products. So I'm just wondering how you define what a sex shop is as opposed to a pharmacy, because this specific store, and I know you can't comment on it, but they fall kind of within a gray zone. So I'm wondering what the regulations are when you've got something that could be considered in both categories.
So thank you for the question. And based on the specifics that we have on sex supply shops, they're just prohibited from offering direct service to the public. They can still provide pickup and online sales. With respect to the pharmacy, I can't really comment on that specifically. Perhaps the medical officer of health may want to comment on that. But based on the information we have, sex supply shops are not permitted open, even if in this case they're suggesting they're pivoting. I'm not going to comment on that.
And I think if I can add just a little bit further to that, certainly a clinic and a pharmacy would be offering perhaps products that are similar to what's being offered in this store. And again, I don't know the specifics of the details, but they would also be providing other medical supplies and services, which would clearly be essential. So, if that helps to round out, the perspective, I offer that. But at the end of the day, again, what this all comes down to is how do we manage the necessities of life, but in a fashion by which we actually stay home to the greatest extent possible. The mayor just said, what will give us, reprieve in 2021, and what will help us get to that point of reprieve sooner rather than later is if each of us who can does our part as much as possible by staying home, limiting our social interactions only to those with whom we live, wearing our mask, washing our hands, doing all the measures for self-protection that we've spoken about for weeks and months now. They sound, relatively simple, or, they may even be a little, tired. You may be tired of hearing about them, but in fact, they are incredibly powerful as tools as we seek to fight COVID-19.
Is that the last question?
There's one more question. We're coming back to Austin Delaney from CTV, who had a question during our technical meltdown there. So Austin, go ahead and re-ask your question, please.
Thanks, Brad. Appreciate the re-ask. Dr. de Villa, Tender Care in Scarborough, it's a long-term home. It's in dire straits. There are 118 resident cases. 21 residents have died. There was a doctor who went in there on the weekend, spent about 5 hours in there. It's not the doctor for the facility, but says it's time the military was called in. Do you have any thoughts on that? The mayor, your thoughts as well.
So, Austin, when it comes to long-term care homes, we know that these are very, environments in which COVID-19 can spread easily, and we know, unfortunately, that residents of long-term care homes are also quite vulnerable to severe impacts associated with COVID-19 infection. So it's certainly something that we take very, very seriously. I cannot speak to the specific details of that case. I'm happy to go back and speak to the team and get the details offline. However, what we do is we work in partnership and in collaboration to the greatest extent possible with home administration and with hospital partners to ensure that the circumstances within the home are as safe as they can be. And there are some environments where it is extremely challenging, given the configuration of the home, the age of the home, the way the rooms are set up. Some environments are simply just very, very challenging in which to control COVID-19 once that virus surfaces in the home. And, it is, with the discretion of those who are managing the outbreak, to make sure that we're doing the best that we can with the resources that we have available. So to my mind, all the options are on the table. People do need to explore the full range of control options. And again, I'm happy to speak with speak with the team around what is happening specifically in the home, what the options are, and what makes the best sense in order to protect the health and safety of the residents in that home or in any other home in the city.
Austin, I would just comment as follows. Recognizing that long-term care is principally a provincial responsibility, our job throughout in managing this pandemic in the city has been to save lives and protect lives, and I would abide by the advice of the Medical Officer of Health with respect to asking any other government or any other body or agency, including the hospitals, for help if that's what advice I was given. And the medical and scientific experts know best who can provide the kind of help that is needed if it's needed from outside, and this is certainly a tragic situation by the description of it, and so if advice is offered that we should ask for help, I'll certainly join in making that request for extra help from whoever could provide it to those residents and staff in places like that.
Okay, thank you.
As a follow-up, I just want to
Yeah, go ahead, Austin.
Can I circle back? There was a terrible echo on my first question, and that's the reaction to the Moderna vaccine. Is that a game changer?
So, Austin, I think we have all welcomed news of the addition of vaccines to the toolkit that we have amongst the tools for fighting COVID-19. So it is certainly a very, very welcome addition, and I think we characterized it as a bit of a Christmas gift or a holiday present for all of us, frankly. But it still comes down to this, and you've heard us say this over and over again, because it is incredibly important. As valuable as vaccines are, and as valuable as we expect vaccines will be over the course of the next several months, what will help vaccines to be as effective as possible in terms of fighting COVID-19 and reducing its spread are the behaviors that each and every one of us can take. So the more we are able to stay home, the more we are able to limit our social interactions, the more we wear our masks and wash our hands and stay home when we're sick, the better off we will be as individuals and as a community, and the more effective our vaccine efforts will be as well in terms of reducing COVID-19 spread and protecting the health and safety of all of us in the City of Toronto.
May I just add one comment that I think is very practical that people have to keep in mind in all of this. This is wonderful news that another vaccine is coming and there'll be more to follow, and that a supply is coming to Canada and to Ontario and to Toronto. But the timetable set out by the governments, the provincial government particularly, who have said when people will be vaccinated, suggests that most people in the City of Toronto and even beyond will not be vaccinated themselves until a period of time that might be a couple of months from now. And in the meantime, we have to do the things that we have to do to stop the spread. The vaccine will not be helping in that way. It'll help some of the people working in long-term care and hospitals who are being vaccinated today. But for the vast majority of people, they can look forward to the vaccine, but they have to engage in this other compliance with public health guidelines in the meantime, because 2 months is a long time with the kind of case counts we've seen, the kind of spread that we've seen, and the vaccine won't be helping us in a material way with the vast majority of people during that time. It's something to look forward to, but forward is the operative word there, 2 months or so, and people have a lot they can be doing in the intervening 2 months to help us get our numbers in shape and get ready for the benefits that the vaccine will produce when they have access to it themselves.
We have one more question from Stephanie Smythe from CP24. Steph, go ahead. You need to unmute yourself, Stephanie.
Here we are. Sorry about that. I just want to go back, if I may, to the tender care home. You know, there seems to be this mayday call, urgent plea for help at this long-term care home. And I'm not sensing there's urgency with respect to this particular care home right now, where, you know, they're saying that the people living there are dehydrated, where, you know, they're pleading for help. Is this not a 911 call for this particular facility right now? And if so, how quickly can you mobilize to get help there?
So, Steph, you know, please don't mistake my comments for a lack of urgency or a sense of indifference. I would suggest to you that every single outbreak within a long-term care home or in any setting, and every case actually matters deeply to those of us at Toronto Public Health. You know, in this particular case, you know, I just didn't want to, and I never want to speak in an uninformed way. And I think it's important that we really focus our comments on those things that we can speak about in a very informed manner. Every single one of these situations concerns us. Every outbreak is a source of concern. I think that it is challenging to describe from here what makes the best sense, but I can tell you that while the homes are the primary agency, they are responsible for running their homes. Public health works very hard with the home management and with the hospital partners who are providing infection prevention and control support and outbreak management support. We work together as a team to do the best we can, but it is premised on the very specific assessment that happens on the ground. And I'm not in a position to comment in an informed way on what the nature of the assessment is at this moment in time. So as I indicated earlier, I will go back to the team and ensure that all the actions that are necessary are being taken, premised on their assessment as to what's happening. And again, we will continue to provide the best support we can. That is our role in public health, to support long-term care homes in terms of the outbreaks that they face, whether they're COVID-19 outbreaks or otherwise. And we will continue our commitment to supporting those partners in long-term care and to work with hospital partners as well to bring the best available science and the best available knowledge in terms of controlling COVID-19 as we can to that setting and to any other setting that's experiencing an outbreak.
Okay, thank you for that, Dr. de Villa. And I just next I wanted to ask Mayor Tory. Mayor, I heard, and I'm looking for any confirmation from you or not, that here we are 2 days before Christmas, people likely still scrambling to get things sorted before their version of the holiday this year. But with respect to curbside, I was told that Toronto Police were ticketing people stopping in their vehicles curbside to pick up packages at locations, especially in downtown Toronto. Can you tell us if there's any directive to or not to ticket people as they pick up gifts curbside heading into Christmas?
As you know, I don't issue those directives. They're issued by the police service to the parking enforcement officers. And in response to a question received this morning on CP24, I did contact the police chief, and he's indicated that there's going to be a greater discretion that is going to be exercised over the holiday and lockdown period with regard to traffic regulations generally. And I certainly hope that applies to people in the remaining time to shop who are trying to pick things up. We as a city moved to create a whole bunch of curbside pickup zones where people could park for 10 minutes to get a parcel because we want to see small business supported. And even in the next 2 days and frankly in the period after Christmas, with the curbside pickup still allowed, we want to see people doing that and supporting local businesses. And I'm very hopeful that the directive that the police chief did issue after I requested that he consider it will apply to having greater discretion for those who stop for a minute to pick up a parcel, knowing that traffic levels are down. It seems very reasonable.
Okay, thank you.
Thank you both. Merry Christmas.
Thank you, Steph.
I just wanted to say, and Dr. de Villa can speak for herself, but I'm sure I speak on her behalf and on Chief Pegg's behalf and Brad's and all the people that are involved in these avails to say thank you to the media because we sat here all these days, initially, I guess 3 days a week and still several times a week to convey information to people and to try and reassure them, to try and answer questions that they had as well as that you had. And but obviously it required you to be doing what you did, showing up and asking the questions and providing the answers. And when the talk is made of a reprieve, you'll have a reprieve from us for only a week, in that we will be visiting with you again next Wednesday, hopefully to report on better news. But it's been very important to us to have this opportunity to be able to speak through you to the people and have them understand what we were trying to do to make things better. And so I just wanted to say thank you for that, and that you will have a reprieve for a week. We'll be around if obviously we're all talking to each other through the holiday period if things are not going well, but otherwise we'll be here in a week. But I just wanted to say thank you, and we'll have time before, you'll see us again before New Year, so we won't, I'll just wish those who celebrate Christmas a very Merry Christmas, and the media who've been helpful to us. And we've thanked here the people that put these avails on for us every day. There's a whole team of people, including interpreters, who find it impossible to keep up with how quickly I speak. But having said that, everybody's done a great job to try to make sure the public are informed, which is what we're all trying to do. So thank you.
Yes, if I could, I would simply echo the mayor's message of thanks to all of you for helping us get our messages out there. I wish you a happy holiday season, and I'll ask that you enjoy your reprieve at home, only socializing with those with whom you live.
Thank you, Mr. Mayor. Thank you, Dr. de Villa. And thank you as well to the members of the media for all that you've done in these last 9 months, 10 months, 11 months. Thank you. Have a very Merry Christmas. Please stay safe. And thank you as well to our AV crew who worked very, very hard to bring these to you. And apologies for today's technical glitches, but we got through it. So please stay safe, everybody, and we'll see you in 1 week.